Boyer, BizTalkRadio. Joining me now is Professor Kevin McGirr, and he's taught in schools of medicine, social work, and public health, and also clinical professor, School of Nursing, UC San Francisco. Professor, welcome to the program. Nice to have you with us.
Good to be here.
So, tell me why you are such a fan of smokeless tobacco and what this is, this new trend that's happening in this country right now.
I think I could reduce you, Frankie, to just a couple of words, and that is combustible tobacco kills. I think we clearly have seen that historically over many, many decades, particularly since we've been manufacturing cigarettes. And more recently, in the last century, we became quite aware that hundreds of thousands of people, and still probably about 500,000 people, are being killed each year because of combustible tobacco use. So anything that we can do as a society, as a health industry, as the business community to move people away from combustible tobacco is an important and progressive step.
Okay. Professor, if I could ask you, I'm hearing wind in the background. If there's some way that you can not move or do something different with the phone, that would be really helpful. Thank you.
Okay. Does this help?
Yes, thank you. That's much better.
Okay.
Is it true, though, that smokeless tobacco does not give you cancer? I don't know what the answer is to that question, and I'm asking it from a place where I don't know what the stats are, what the information is.
Yes. Okay. So in terms of smokeless tobacco, we know if we look at Sweden, where they've been using, snus or chewing tobacco for quite some decades, we know that they have the lowest cancer rate of any particular nation around the globe. So that's probably the most robust data that we have. I mean, more recently, in the U.S., we certainly have seen, the rate of lung cancer go down, mostly because fewer people are smoking, and those who were smoking have stopped. But with respect to whether we're going to see a correlation between, say, electronic cigarettes in particular,
yes,
the jury is still out. We'll have to wait and see over the next couple of decades if that bears out. Now,
well,
again,
we're starting to see young kids, which is so disturbing, using these new electronic e-cigarettes. And so that has been disturbing, and they're addicted to them. So what are your thoughts about that, and how do we handle that as a society? Because they were not designed for kids. We know that. You and I both know that.
Correct. Frankie, I think it's a very complex issue, and clearly, just like with all substances, we want to do whatever we can with laws, regulation, and education to keep electronic cigarettes and all substances, out of the hands of minors. However, we also know that the reality is, and I don't think this is going to change in the foreseeable future, is that particularly adolescents, they experiment with all kinds of lifestyle issues, including drug use. So we want to continue to monitor and see what the impact might be with that particular population. But again, we want to definitely see that there are regulations, laws, and education in place that discourages minors from using those products.
Right. Absolutely. What is it, though, about smokeless tobacco that people like?
I think what we know, Frankie, from other tobacco interventions and smoking cessation, that there is some percentage of smokers who essentially do not take to what currently exists, and I'm primarily looking at the conventional and the FDA-approved nicotine replacement therapies, patch, gum, lozenge. And what we also know is about smoking and nicotine, that it's not just nicotine. People are also habituated to the sensory motor, the psychosocial aspects of the habit. And when we've given people the NRTs, we've deprived them of that aspect of the behavior. And we know that the other, again, the sensory motor, psychosocial aspects are a very important part of the habit, where particularly electronic cigarettes, as opposed to chewing tobacco, they hold a lot of promise of replacing the non-nicotine aspects of the habit for individuals, the hand to mouth, the social aspect, something to do, whereas putting a patch on one's arm to replace, very effective for some people, not effective for all. And those individuals for whom it doesn't work, some people complain about certain kinds of side effects. But I think the other aspect is that there's a passivity about that behavior that doesn't satisfy people. So giving people a device that removes all the poisons, all the toxins, the cancer-causing agents from individuals' habit is certainly, from my perspective, a very progressive way to go.
It makes sense. I know that for me, and I'm very honest, as a former smoker who was 3 packs a day, I used a filter system that was way back when I gave up smoking. And I made the decision that I would never smoke without the filter, and then finally they stopped making the filters. I couldn't get them. You know, this was way before internet, and you could go to online and find it, or eBay, or any of those things. And so my last one fell out of a window of a very fast highway. That was the end of that. And so I made the commitment that I would never smoke after that. And I was fortunate. But I was on that filter for 1.5 years. So I get.
I think we
I get that.
Know, I mean, yes, and I don't want to downplay the fact that nicotine is in fact an addicting drug. People definitely,
Hey, Professor, where can people find out more information? Because we're out of time.
There's so many websites. I think people can essentially do a Google search and put smoking alternatives, electronic cigarettes, anything into the search engine, and a lot of information will come up.
Awesome. Thank you so much for being with us, and thank all of you.